Hello, I am Director Park Sang-ho of Royal Animal Hospital. Today, when performing cancer treatment at Norian Clinic, nutrition is very important. If diet control is not properly managed, in fact, it is difficult to achieve good results in chemotherapy. Among these, beef is the most common problem. If you have started cancer treatment, beef, you should not eat beef as is. You should not eat it. Regarding the reasons why you should not eat it, today, I will explain each one. First, children who are now treating cancer. Foods they should not eat. There are 4 main ones: beef, pork, and baked or steamed sweet potatoes, and white rice. Rapidly increasing, something you should not eat foods that help cancer grow. And in a diet for cancer, like white fish and chicken breast. It is white lean meat. And now eggs, and omega-3 or MCT oil. Now quality fats and those with antioxidant effects. Oils are very helpful. In the case of eggs, such as boiled eggs, it is better to mainly eat the egg whites now, because the yolk contains iron. It is better to consume only a small amount of this. The beef is very delicious, and there are many who live by eating beef. There are too many puppies. So, eating this beef. Dogs that have this habit. There are many cases where cancer develops rather quickly. And with such eating habits, even if surgery and anti-cancer treatments are performed to treat cancer, there are not many cases where good results are obtained. Why does this kind of beef have such an effect on cancer treatment? Whether it poses a major obstacle? I will explain this with 4 reasons. The first reason is methionine. The ingredient known as methionine. This methionine is one of the essential amino acids. Beef contains a large amount of that matched enzyme. It grows explosively by depending on the matching enzyme. It activates and can actively carry out such cancer metabolism. The problem lies in this beef. This beef contains that white flesh more than fish or pork. There are significantly more methionine. You can consider it almost like a bomb effect. When you eat beef, on that side, for anti-cancer agents or anti-cancer treatment, some methods are being used to control cancer. On the other side, a match-on treatment is being applied. So, what this means is, you are simultaneously allowing the disease to worsen and trying to eliminate it. In this case, it is obviously difficult to achieve good results. In such cases, our hospital had a similar case. This dog was a 14-year-old Cocker Spaniel named Jerry. If you look at our hospital's blog, there is a review of this dog. In this dog's case, the miscarriage was completely removed at a university hospital and received antibiotic treatment for 3 months. Then, the miscarriage mass was right in the center of the abdomen. Miscarriage symptoms appeared even though there was no miscarriage. So, the university hospital said there was nothing more they could do. So they told me to go home, and that's why I came here. At our hospital, we now remove this lesion without surgery. So, as a treatment, we successfully removed the tumor. But look, it came back here. Among the cases treated at our hospital, this kind of cases, there aren't many cases. In this instance, the stock was actually beef. So back then, I wasn't exactly sure why this happened. I didn't know whether the metastasis or nearby metastasis happened quickly. Recently, this was confirmed through data investigation. And the second is that beef is not allowed. The second reason is what is called heme iron. Now, you can think of it as iron. Simply put, iron is actually essential during DNA replication. It is one of the absolutely essential components. So cancer cells replicate and divide. Because it is an essential component, cancer cells require a lot of iron. But the problem is this red color in the beef. This red color appears red because of the iron. How much iron do you think this contains? The third is arachidonic acid. Usually, cancer doesn't start off as cancer from the very beginning. It is very rare. In most cases, inflammation repeats and persists over a long time. And often it turns into cancer. We usually refer to this beef that has very good marbling. And omega-6 in this beef. This omega-6 is exactly arachidonic acid. There is a lot of this arachidonic acid in beef with well-developed marbling. When we experience inflammation, this arachidonic acid is what causes symptoms along the inflammatory pathway called COX-2. When it is transmitted to the prostaglandin, this generates inflammatory signals, which leads to inflammation, thus causing the body's inflammatory response. This arachidonic acid, which is the direct cause, simply put, it is omega-6. There is too much omega-6 in beef. Therefore, beef has a very harmful effect on cancer. Fourthly, toxicity arises from phosphoric acid. If you eat beef too much as a staple food, like the child I showed you earlier, the ratio of calcium and phosphorus in the blood breaks down. The phosphorus level becomes very high. In such cases, when the blood concentration is too high, if this enters the cancer cells, inside the cancer, this pathway called AKD and these two pathways called YOMTA. These are all pathways that activate cell proliferation and growth. These pathways become highly activated. In fact, even if you undergo anti-cancer treatment, you probably won't achieve significantly good results. Therefore, at our hospital, most cases for those who have dogs older than 7 years, there are plenty of treats, including duck and some white-fleshed fish, like carp, cod, and similar kinds. Or there is also chicken breast now. But insisting on eating beef is not recommended for about 4 years now. For intractable cancer treatment at our hospital, many people are coming to receive it. The first step we start with at our hospital is this. At the very beginning, you must start with food. That is, if food is not controlled, food contributes to cancer growth. Without following a diet capable of suppressing it, the method of undergoing anti-hormonal therapy is. In reality, it can lead to a situation that only causes suffering. If you are undergoing anti-hormonal therapy or after being diagnosed with cancer, how to care for your child going forward. Those who are worried. First of all, you should stop eating beef. And if you can, these 4 foods: beef, pork, sweet potatoes, boiled, carbohydrates that were added. These high-fat, high-protein foods are actually best avoided. Thank you.